parity, I should say, broader parity than the federal. Yes, sir.
Yeah, I'm a lobbyist. I've been lobbying for the Psychiatric Society and the Mental Health Association on the state parity law for 15 years. So we're happy to see the federal law. But the other big difference is the federal law applies just to groups of 51 or more employee groups. Or, you know, so if you had a group policy that covered, you know, work for a company that had 48 employees, it doesn't cover you. So that's one of the main reasons we still need a state law. And the federal law is almost identical, not in words, but in its impact as to the proposed law at the state level. There's no mandate. Yeah, neither the federal law nor the state law mandates anything. It just says you can't discriminate. You can't have different limits, different co-pays, etc., for mental health coverage than you have for medical surgical.
Thank you. Did you hear the comment, or should I repeat it?
Follow up to that. I heard at one point, maybe I misheard, that if your current program doesn't have any reference to mental health in it, this new act has no relevance.
That's right.
That's right.
That's right.
So,
it doesn't force you. It doesn't force an employer or a plan to offer mental health benefits.
so then,
But if it does,
the statement in terms of that we got parity, that's not a true statement. I mean, it's not there. All you're saying is that you can't have a different structure in terms of reimbursement,
right?
but it's got nothing to do with parity. I mean, I think this is, I'll go away from here saying this is mislabeled. This is not parity. This is financial parity and benefit, but it has nothing to do with whether or not there is now a day open where mental health is available. It's not.
I agree with you. I agree with you.
Well, I was living in an unreal world.
I come from the holistic world, and I had to, if you want to, we're being controversy with the medical model of mental, because of mental and substance abuse, because of my mother and my sons and family. I have firsthand, the medical people don't really want to hear what the holistic have to say because of money. It's money. And people coming together, and I truly believe we have to work together because there are answers, and there are answers that would cost not as much money as the medical model if they would incorporate. And so we have to work together, in my estimation, because it's nobody wants to see the whole picture. Everybody wants to protect their paycheck, okay? And we have to work together. All right, and the medical model is creating a lot of our substance abuse. And it isn't just street drugs that are causing substance abuse. It's prescription drugs and all of it that go together. And so they got to come on the same page and be open and receptive to other than what's creating my paycheck. What's good for the whole community. There's more than one answer than what can be legislated.
I agree completely. I think the holistic health approach, I'm from a school of public health, it's a piece of it. But I mean, the public health piece, the medical model piece, I think if I could, if I could fix the whole health system instead of using kind of these little incremental approaches, these are incremental plans and incremental pieces of legislation. It's like you try and make some steps in that way, but it doesn't solve problems with the uninsured. It doesn't solve problems with employer-based health plans that no longer cover their employees, or it doesn't solve employer-based health plans that don't have mental health coverage. And so you're still dealing with a very small portion of people who are now getting care who didn't get care before. But it certainly doesn't address all of the issues that you raised or that the gentleman over here raised.
This holistic approach that you're referring to, is that the combination of counsel plus the administration of the appropriate medications? I'm not sure what all holistic involves.
That's probably a better question for this other.
And the only reason I ask is because I know that it seems that the dispensing of medication, I don't know how costly that is versus the intensive counseling and the sessions and the time that it takes to have a professional to help a person unwrap those situations. And I'm wondering if that's the big cost driver that's causing the concern and creating the issue of of parity, because if that could be open-ended, and the concern is how much is this going to cost, because we don't know how long this is going to take to get to the heart of the matter.
I'll see if I can paraphrase what you said. That I think your first question was whether holistic health addressed or included both the administration of medication and counseling. So would that be more holistic if you had both included in that?
I wonder if that's what that means, if those are part of it. Is that the part of it? Is that what holistic means? Is counseling, and what does it mean?
Holistic is another approach using other ways. Counseling is, yes, a part of it. I'm involved in emotional release therapy. I'm involved with the physical, the mental, and the energetics of the whole person. You got to take the whole person into the thing. Yes, there's counseling. Yes, there's other, if you want to call it medications. They're not. I don't call them medications in the midst of because drug therapy isn't the answer for everything. Even though the medical model, that's their main premise. But it's taking the whole person in, and other approaches other than sedate them or put them in a. It's a bigger answer than just putting things together. I agree you need things together.
I just wondered, because I know that the cost is such a great concern, and I wonder if it's because the treatment is often, it's not like treating some sort of a medical illness where I guess they try to resolve it, they administer this medication, they do this surgery or whatever, and they take care of the matter.
The holistic approach from where I come from is in the midst of what causes a disease. Your mental emotional states create a dis-ease within the system that causes this thing we call the swine flu that's got everybody going on. I'm paraphrasing, but it isn't one answer. It's a whole thing, but it adds to, it doesn't. We're discriminated against in the midst of all the laws and the legislation and the medical mind model. They have their way.
I understand. I want to give opportunity for just a couple more questions here.
Is there anything within the realm of coverage for mental health that defines what can be considered a pre-existing condition?
That defines what?
What could be considered a pre-existing condition, where I know some insurance companies have clauses where things that are defined as a pre-existing condition would not be covered. How is that defined, where I feel like in the mental health world it might be a little more slippery if someone has a chronic condition and then something else onset by outside trauma? Is there anything that defines that?
There's nothing in the mental health parity and substance abuse addiction. Insurance is regulated by the state, and so like individual insurance or individual policies, and I'm pretty sure that pre-existing condition regulations are also from the state. So it would be. So I don't have any kind of direct answer to you on that way. With regard to the Parity Act. Any other questions?
Could you just clarify the cost exemption that you described? What is the exemption? I guess I'm a little clear on what you mean by exemption. What does that mean? Well, I'll let you explain.
Okay. The Parity Act says that if you're offering mental health benefits and medical benefits, that you have to make the mental health benefits as rich, if you want to say, or as financially equal as you do your medical benefits. So if you have a medical office visit and it's a $15 copay, then you may not have had it before. It may have been a $50 copay for mental health visits, but now it needs to be $15. It needs to be comparable. By lowering the costs on those copays, it could increase premiums. And so if the plan takes a look at all the costs before parity and then implements parity